Australia has confirmed its first case of coronavirus and raised its advice for the Chinese provinces of Wuhan and Hubei to do not travel. The Chinese national, aged in his 50s, has been isolated and is being treated in Melbourne's Monash Medical Centre. He had returned to Melbourne from Guangzhou on January 19. Victorian authorities say all passengers on the affected man's flight will be notified.
China Southern Airlines flight from Jiangsu to Melbourne, flight number CZ321. So we will be contacting, obviously we'll be working closely with the airline involved and Commonwealth officials to secure the contact details for those passengers. Those passengers will be contacted and encouraged to seek medical advice if they have any concerns.
It is highly likely there will be other cases. There may be other cases on this flight as well. But again, everybody coming off this flight will be getting advice about monitoring themselves for symptoms and contacting a health professional should they develop any.
7 people in New South Wales and Queensland are waiting to find out if they have the virus. Health Minister Greg Hunt has assured the public Australia has world-class health systems with processes for the identification and treatment of cases. The Prime Minister has just addressed the media about the confirmed coronavirus case in Victoria.
The confirmation today by Victorian authorities of the coronavirus case was a matter that had been anticipated, as the Chief Medical Officer, Dr. Brendan Murphy, indicated in the course of this week. The Australian Government, of course, has been taking this issue incredibly seriously. We have activated all the necessary precautions and procedures that are in place. Chief medical officers from states and territories, together with the Commonwealth, met earlier today. Health ministers will be meeting via hookup later this afternoon. What I want to assure Australians is that the preparedness and the plans and the capabilities are in place here in Australia to deal with issues of this nature. We have the people, we have all of the procedures that are now swinging into place to ensure that we can provide the protection to Australians. Now, that said, across the country, even as we speak, our border authorities and biosecurity authorities will be ensuring that those flights that are coming from China will be met by our officials, and there'll be appropriate information that is being provided to those alighting passengers. As you know, we have also learned that there are no flights coming out of Wuhan province itself, Wuhan I should say, out of Hubei province, and that is also being supported by the decision that we've taken to increase our travel advisory to do not travel to Hubei province at all. The World Health Organization is working closely with authorities around the world, and we're engaging with them on all of the information that is coming from them in terms of managing these issues globally. But I want to assure Australians that our officials, our medical experts, our clinicians, our border security officials and agencies, our biosecurity professionals are all working closely together at both the Commonwealth and state level. The hotlines have been put in place at state levels. The facilities that are stood up in our hospitals are also there to ensure that anyone who is found to be in need of treatment in relation to the coronavirus can be supported at those facilities. So I'd urge Australians to go about their day, to go about their business in the knowledge that the professionals and the experts that are there to provide the support that is needed in times like this are on the job, and they're getting about it to keep you and your family safe.